Hi, I'm Sandra Cangill, a professor at the University of Pittsburgh in the School of Pharmacy. I'm also the treasurer for the Society of Critical Care Medicine. So when I think about those people who've influenced me, I really think that list could go on forever. However, the very first person that comes to mind is Joe Dasta, since he trained me. And Joe has really been inspirational for me every day ever since. I'd also want to mention Judy Jacobi, who's been inspirational to me as the first pharmacist president of the Society of Critical Care Medicine. Those are the pharmacists who've inspired me, but in the true nature of SCCM, it takes a team. It was the founding members of SCCM, such as Max Weil, Peter Saffer, William Shoemaker, Aki Grenvik, who's really influenced all of us and influenced critical care medicine through their science, through their patient care, and offering SCCM as a multidisciplinary home for the critical care team. When I reflect upon what membership has offered me, I think of mentoring and professional involvement as huge benefits of membership. Professional involvement in the society, attending Congress, and doing committee work has really allowed me to network with a truly amazing group of critical care professionals. It's really unfortunate that we won't be together this year in person to celebrate the 50th anniversary, but hopefully we'll be together again next year. I hope to see you then.
Hi, I'm Judy Jacoby, a critical care pharmacist and past president of SCCM. Congratulations on this wonderful 50th anniversary. And I'm going to miss celebrating in person. I think back to 2010 when we were in Miami. It was cold. It even snowed a little. One of the things in my opening address that I thought was so important to highlight was a statement from one of our founding members, Mack Weil, who in 1972 wrote that our council, which is made up of accomplished, dedicated, and uniquely responsive men, mostly represents the diverse viewpoints of our multidisciplinary organization. I hope our multidisciplinary commitment will soon be evident by leadership roles for non-physicians. This highly inclusive philosophy really sums up why SCCM has been so successful at engaging with members of the critical care team, and in particular pharmacists. It's been a wonderful professional home for me and given me the opportunity to give back to others in the organization and throughout the country, in particular for critical care pharmacists who continue to step up and do amazing things for the care of our patients. It's going to be difficult without an in-person meeting. I miss seeing so many of my lifelong friends, and in particular, the opportunity to thank the staff for their incredible contributions to help support us as clinicians during this COVID year. Happy anniversary, SCCM.
Hi, everyone. My name is Savel. I'm the Director of Adult Critical Care Services here at Maimonides Medical Center in Brooklyn, New York, and I'm also a professor of clinical medicine at the Albert Einstein College of Medicine. Today I was going to talk to you a little bit about why I'm excited and have been excited for quite some time about being a member of the Society of Critical Care Medicine. I've been a member since 2001 while I was still a fellow, and if I had to say what my most exciting moment was, it was back in 2005 when podcasting was just getting started, and I thought, you know what, there should be a podcast about critical care. And I reached out without really knowing any of the leadership of SCCM and just called the main number and said, I think there should be a podcast about SCCM. And not only didn't they say no, but I received a phone call a couple of days later saying, you know what, we're not quite sure what you're talking about, but it sounds like a great idea. And now, 11 years later, this idea that I had working closely with SCCM is still up and running and turns out to have been the first podcast of a national medical society. So my bottom line statement for people who are watching is that if you're not a member of SCCM and you're a member of the multidisciplinary team, it's very exciting to be a member of SCCM. You get to know and feel like you're more in touch with the leaders of our field who've helped to shape the critical care medicine, and you get to be a part of those people who are working to shape our field. If you are a member of SCCM, it's very exciting to become more involved, joining committees, and share with them your ideas of ways to make the society better.
Happy 50th SCCM. I'm Dr. Elizabeth Mack, Chief of Peds Critical Care at MUSC Children's Health in Charleston, South Carolina. With regard to someone I admire in the field, well, there are many. As a student and a resident, I was inspired by Dr. Greta Harper as a strong female role model, Dr. Bob Hubbard as one who injects humor into medicine, Dr. Mark McDonald, who encouraged me to think of Peds Critical Care as a doable career. In fellowship, I was privileged to work with so many smart, encouraging folks along the way. Dr. Rich Briley, who helped me catch the quality and safety bug, Dr. Derek Wheeler, who supported my clinical research and master's work, Dr. Iman Al-Qadra, who exemplified resilience, and other incredible, strong faculty, as well as my insanely awesome co-fellows, Drs. Erica Stolitz, Scotty Day, and Jeff Nowak. I'm eternally grateful to my senior colleagues at MUSC for their guidance and mentorship. And I'll never forget my many shifts spent with PICU RTs, nurses, learning many of the complexities of tube feeds, med administration, respiratory interfaces, and all the things. I'm so grateful to my partners, to the nurses, to the respiratory therapists, techs, and colleagues who taught me so much along the way. Thank you and happy anniversary.
Hello, my name is Jerry Zimmerman, and I am a faculty member in the Division of Pediatric Critical Care Medicine at the University of Washington School of Medicine here in Seattle, Washington. My SCCM membership number is 370, indicating that I have been a member of the society since 1987. The best professional experience of my lifetime occurred during my tenure of service on the SCCM Council, and particularly having the honor of serving as president for the organization during 2018 and 2019. For this 50th celebration, congratulations to the Society of Critical Care Medicine, and particularly to all of these seen and unseen people who have nurtured and grown this amazing organization. Critically ill and injured patients and their families everywhere salute the Society of Critical Care Medicine for facilitating the concept of right care right now by an interdisciplinary team of dedicated experts. Honoring the past, yes, of course, but looking forward to an even brighter future.